Hi, and welcome to the Neuromuscular Junction with Mark Tarnopolsky. I'm the director of the Neuromuscular and Neurometabolic Clinic at McMaster University, and today we're going to talk about exercise training for inclusion body myopathy. Inclusion body myopathy is a muscle disease that affects people generally over the age of 50. It's about 3 times more common in men than women, but women, of course, can be affected. It's an insidious disorder, starting off with very, very slow weakness. The 2 main muscles that are affected are your quadricep muscles, which is your muscles that you use to extend your knee, and the deep finger flexors. Often it comes very, very slowly, and the first things people notice with their legs is that they will stumble and trip, and they don't know why they fell. They have difficulty getting out of a chair, going up a flight of stairs. With the finger flexors, it's an interesting muscle because it's not just the whole grip of your hands, it's particularly the ends of your fingers. So you can see when my finger here is moving, that's the deep finger flexors. And so usually it'll be in something like where you have to hook your fingers where you notice that there's weakness. And the way we can test it is we just hold the finger straight like this, and we can see if you can bend the end of the finger, or simply you can just grab onto someone's fingers and go like this. What happens is people can't, for example, clip their nails. Doing buttons becomes more difficult. Those are usually the first manifestations of the disorder, but over time it does affect swallowing in about 70 to 80% of patients. Swallowing first are solids, so people have difficulty, especially with particulate food, dry chicken, these sort of things. Now there are some therapies that can help with swallowing, and even exercise may be of some benefit. There have been no studies specifically with that, but we've done and published some work using Botox to loosen up what's called the upper esophageal sphincter so that people can swallow better. Sometimes they can even dilate that as well. So if you're having swallowing studies, we'd recommend swallowing assessment, and then following that, if it is affected, you should see a gastroenterologist to consider either a dilatation or Botox into selective muscles. Now, with respect to the fingers and the thighs, what can we do about that slow decline in function, which leads to functional impairment? Well, some people feel that exercise is of no benefit with muscle disorders, but that's just not the case. And IBM, in fact, is one of the best examples where exercise therapy has been shown to be of some benefit. In fact, there have been several studies over the years. One in particular, the first author's name is Spector, and they showed that regular resistance exercise training resulted in quite significant improvements in muscle function in patients. And this is important because people have tried prednisone on its own, they've tried IVIG on its own, and there's really no effective therapy that's going to slow down deterioration. The only study, the only therapy that's been shown to improve function is regular exercise. And we certainly see that in our patients, but it's important that we exercise the correct muscles in the correct manner. We're going to go through all sorts of different exercise programs with both strength training and endurance training. And in general, we recommend a combination of both. So if you can get up to at least 3 times a week of endurance training, 30 to 35 minutes, and it doesn't matter what you do as long as you enjoy it so that you'll keep doing it. So things like biking, even if you can't get onto a regular bike, a reclining bike is very safe and easy to get in and out of. Rowing, ellipticals, treadmill if that's safe for you, walking with trekking poles, for example, cross-country skiing. There's many ways that you can do aerobic activity. And you should try to gradually get yourself used to it. Once you get into shape, you still should be pushing yourself a bit so that you feel warm and that you're starting to feel that you have to take a few breaths in between talking to someone. You don't want to be so out of breath that you can't actually carry on a conversation, and listen to your body, gradually get used to it. With respect to weight training, which is where most of the studies have focused, we can start off, for example, doing what are called sets. We do generally 3 sets, and we're looking for 12 to 15 repetitions. So in our Coming to Terms with Terms video, we can go through what that means. But essentially, a rep is going through one motion, and a set would be going through, let's say, 12 or 15 times, and you would go back to a second set and a third set. So the muscles that you want to focus on with this disorder first of all, are the deep finger flexors. So there are several different ways we can train hand grip, and we're going to show you some specific videos on that. But in particular, you want to make sure that the ends of the fingers are actually being exercised. And it's good to put, for example, either a ball, for example, or a special hand gripper where you can put the ends of your fingers on, either in the car or beside a television, so that you can do this on a regular basis. The other muscle, of course, are the quadriceps. That's the knee extension muscles. So these would be things like leg press, knee extension, or even if you don't have that type of equipment, just getting up and down from a chair with your arms crossed in front of you, or if that's too hard, using your arms to push up. Those are exercises that will help with the quadriceps. But we're going to go through whole body type of activity, because although those are the main muscles, people eventually do start to see weakness in other muscles. So we like people to do generally a whole body type of resistance exercise training program, such as they did in the Spectre study. And you will find that if you do this properly, there'll be some slow improvements in function and or a slowing of the decline of the disorder over time. And what we really want to do is to preserve muscle function or improve your muscle function to decrease fall risk and allow your daily activities to be easier. Getting out of a chair, going upstairs, using your hands for various activities. So again, please take a look at some of our specific videos, how to exercise safely with endurance exercise and resistance exercise, keeping in mind for inclusion body myopathy, some of the muscles that you really want to focus on, and hopefully you'll have a safe and enjoyable experience and improve your function. Please subscribe to our channel. If you have any comments, leave them in the comments section for any future videos, and thank you very much for tuning in.